STD or sexually transmitted diseases are commonly used term for the medical conditions that are transmitted through sexual contact. It can only affect when you have sexual contact with someone who already has the infection. One common STD which is highly contagious is gonorrhea. It affects both women and men which are spread through vaginal, anal, or oral sex while a partner who already has it. Symptoms of gonorrhea during pregnancy, it is hard to diagnose as it does not show the signs straight away. To prevent gonorrhea is to get yourself checked on your first visit to prevent or decrease the risk of passing it on to your baby. If kept untreated, it leads to miscarriage and premature birth. It is important to seek treatment as soon as possible for the mother to prevent any risks. The difference between HIV and AIDS. HIV is a virus that attacks T cells in the immune system. AIDS is a syndrome which appears in the advanced stages of the HIV infection. HIV causes AIDS to develop. The early stages and symptoms of the HIV infections could last up to 4 weeks after catching the virus. Fever, chills, joint pain, muscle ache, sore throat are some of the many symptoms that patients might feel, and these only last up to 4 weeks. But if the patient is left untreated, HIV weakens the ability to fight the infection. The late stage infection is called HIV. The late stage signs and symptoms are blurred vision, diarrhea, dry cough, fever, night sweats, white spots on tongue and mouth. Late stage infection may be life-threatening, and the risk of keeping it untreated is much greater. HIV can be transmitted through 3 common ways. If you are having unprotected sex with someone who is already infected, transmitting HIV through blood, sharing syringes contaminated with HIV-infected blood. If tested positive, the test would be taken several more times before a positive result is given. If the tests come back positive, the patient will have to undergo early HIV antiretroviral therapy and take emergency HIV pills, which lasts up to 4 weeks. The earlier the patient starts, the treatment is more likely to be successful. According to World Health Organization, approximately 3.5 million people are living with HIV/AIDS in 2013. 2.1 million people are estimated to get newly infected with HIV. According to World Health Organization, Sub-Saharan Africa is the most affected region with 24.7 million people living with HIV in 2013. That is 71% of people that are living in that region. HIV is the world's leading infectious killer. An estimated 39 million people have died since the first cases were reported in 1981. In 2013, 1.5 million people have died of AIDS-related cases. There are many ways that you can prevent from getting infected by STDs and other harmful diseases. Health education is an important factor in reducing the risk. Having unprotected intercourse without any sort of protection can put you and your partner at risk. Sharing needles and syringes can expose users to HIV.